Preeclampsia is a disease of hypertension and protein in the urine, which affects pregnant women, some pregnant women. It's actually a disease where the woman develops high blood pressure in pregnancy, and affects the kidney by making her have protein in her urine. So it's a disease of hypertension and proteinuria. It is a disease that a woman will not have usually. She's not hypertensive. She develops the disease usually after the 20th week of pregnancy, which is after pregnancy. Pregnancy is supposed to go for 40 weeks or 9 months. So then after about halfway into pregnancy, she may develop high blood pressure. And then this will also affect the kidneys, and that's where you have the proteinuria. It's a very severe disease because why I say severe is that when it does happen, it's associated with a lot of complications. You will ask yourself, why do some people have it? It's a disease of theories in the sense that we don't even know why people do develop it. But it said is one thing is certain, that it's a disease that affects the placenta, that has to do with the placenta, which is what separates the mother from the baby. So there are some abnormalities that have been detected in the placenta, which, when this does happen, women can result with having this disease. And the proof of that is that once the woman delivers, you find out that pregnancy symptoms of preeclampsia revert back to normal. So usually the way it's done is that the best way of detecting it actually is good antenatal care. Also, the antenatal care, we know that when a woman registers, she does antenatal care. Her blood pressure is checked regularly each time she goes for a visit. And of course, her urine is checked for proteinuria. And when this is detected in pregnancy, we know these women can be followed up. So we usually will follow them up with giving them, of course, we have to investigate them. After you've taken your history, you know if a woman is predisposed to what has predisposed her to the disease. You always run some tests, and in mild conditions, where you have the BP between at 140/90 and less than 160/100, we usually would treat them with antihypertensives, because that could reduce their blood pressure. But when the blood pressure is higher than that, with proteinuria, then we know we'll probably be more aggressive with them. So what we tend to do with them is that we tend to give them antihypertensives, and then monitor them to as far as they can go in pregnancy, because we know that even with drugs, the drugs would help the woman in reducing her blood pressure, but will not affect the complications that can happen to the baby. Because some of the complications that can happen to the baby may not grow very well, the baby can die. Okay, those are some of the severe complications that can happen to them. Of course, in pregnant women, it can affect everything, all systems. She can go blind, she can have problems with her eyes, her sight. She can have problems with her liver, she can have problems with her kidneys, she can have, in severe conditions, she can convulse. And when they convulse, that's what we call eclampsia. Preeclampsia is before convulsion. When the blood pressure becomes very high, then the woman can convulse and faint, and with that, they can lose their lives. So like I said earlier, we tend to give them antihypertensives. If the BP is higher than 140/90 and she has proteinuria, we also want to give them anticonvulsants. And one of the best agents is magnesium sulfate, which will actually prevent the woman from having seizures. That's linked to preeclampsia. So we will give them antihypertensives. We tend to want to move them to as close to 40 weeks as they can, because women who usually will have to stay up to 40 weeks to deliver. But with preeclampsia, we may have to deliver them earlier on, because we know with progressive high blood pressure, the baby can be affected, and if you don't do anything, the baby will die. And of course, baby may not grow very well, and the baby can die. So we tend to always want to try and deliver them if they're getting, if the condition is getting worsened, earlier than we get with other women. And that will also prevent complications in the woman being more severe, because you know that high blood pressure affects every organ in the body. So even if when you try to control the blood pressure and the blood pressure becomes uncontrollable because of the disease pattern, you may want to prevent the woman from progressing to a worse level. So that's basically, in a nutshell, of the disease preeclampsia.